Zonisamide is a highly effective broad-spectrum anti-epileptic drug. What we mean by broad-spectrum is that it works both for focal epilepsies and generalized epilepsies. And this is possible because of a two-in-one mechanism. What is this mechanism? We'll see now. It works on sodium channels like carbamazepine. As we know, sodium channels are important in focal seizures and focal epilepsies. It also acts on T-type calcium channels, just like sodium valproate. And we know that T-type calcium channels are important in generalized epilepsies, especially absence epilepsy. Thus, zonisamide has two-in-one mechanism of action, both on sodium channels for focal epilepsies and calcium channels for generalized epilepsies. It also has less important action, a weak inhibition of carbonic anhydrase that is not clinically significant. It also has effect on dopaminergic system, which is useful in Parkinson's disease, and it is approved in Japan for the treatment of Parkinson's disease. Now let us go a little deep into these two mechanisms. First is sodium channels. This is a normal function of sodium channels in the neuronal membrane. If you look at the sodium channel at 9 o'clock position, that is the resting state, which is closed, and during depolarization the sodium channel opens, the sodium leaks into the intracellular compartment, and that is called open state. What we see at 3 o'clock position is an open state. From the open state to 12 o'clock position, that is a closed state, that is called fast inactivation. So if the channel remains in open state, it is prone for repetitive firing, which is a characteristic of a seizure. And you want to terminate a seizure or prevent a generation of seizure, it has to be inactivated quickly. So that is what zonisamide does. It enhances the inactivation of the sodium channel, also called fast inactivation, because it takes only 1 to 2 milliseconds for inactivation. At 6 o'clock position, you can see lacosamide, that is a slow inactivation, it takes up to several seconds. So lacosamide enhances the slow inactivation. Zonisamide, phenytoin, carbamazepine, they enhance the fast inactivation of sodium channels. So this is how zonisamide works on sodium channels. Coming to the T-type calcium channels, this is the circuit of basal thalamus and the cortex. On the blue side, you see thalamic reticular nucleus. In the red, that is thalamocortical neurons, and finally the cerebral cortex. This forms a network. And the burst firing of this thalamocortical network is believed to be responsible for the generation of absence seizures. The 3 Hz spike and wave discharge of absence seizure is due to the T-type of calcium channels. So zonisamide blocks the T-type calcium channels and inhibits the burst spiking of the thalamocortical networks, causing inhibition of generation of absence. So the low threshold burst firing mediated by the T-type calcium channels is implicated in the synchronization of thalamocortical circuit. So these channels are found both in thalamic reticular nuclei and thalamocortical neurons, and they are critical in the generation of spike wave discharges, which we see in absence epilepsies. Zonisamide blocks the T-type calcium channels, thereby preventing the burst firing of these circuits. So these are the two most important anti-epileptic mechanisms of action of zonisamide. And lastly, in Parkinson's disease, zonisamide is approved in Japan as an add-on drug for PD. It is used in low dose, about 25 mg or up to 50 mg per day. At this dose, it leads to significant reduction of off time without increasing the dyskinesias. So it supplements the levodopa which we use and reduces the off time without causing any dyskinesia. It also benefits the non-motor symptoms like impulse control, REM sleep behavior disorder, and some cognitive decline also. How it achieves this? A lot of mechanisms have been proposed, including MAO-B inhibition, T-type calcium channel blockade, modulation of levodopa metabolism, and modulation of receptor expression, dopamine receptor expression, and in the long-term neuroprotection may also be involved. So these are the 3 mechanisms of action of zonisamide. Thank you.